So good afternoon, respected dignitaries, all the participants, and my fellow colleagues. I'm Dr. Abdul Razak, associated with CSE Department, Anjuman College of Engineering and Technology, Nagpur, and co-coordinator of this 1 week Aicte-Atal online FDP. Today we have with us a very renowned personality, Dr. Rizwan Ahmed, who is going to deliver an expert session on smart healthcare system. So, Dr. Rizwan sir has already delivered one expert session before. Sir, Dr. Rizwan sir, we welcome you in our FDP session. Now, without any more delay, I hand over the session to Dr. Rizwan. Dr. Rizwan, please take over the session. Thank you.
Thank you, Dr. Abdul Razak, sir. Good afternoon to all the participants. Let me go ahead and share my screen just a moment. I'll request the organizers to confirm if my screen is visible.
Yes, sir, it is visible.
Okay, thanks for the confirmation. So, good afternoon to all the participants. So, this is my second session. So, today I'll try and talk about some of the smart healthcare systems, right, which personally I'm seeing being developed, right, in last 10 plus years, right. And as I said in my previous session, I've been fortunate enough to be involved in developing some of the similar systems, right, in some good shape or form. Again, having impact in India and outside India, right, in terms of healthcare systems. So, as I generally like to keep things interactive, right? So, I'm sharing an image, and questions to the participant is to start the day, right? Do you all recognize the image in the photo? Do you know what this image is representing? And if you know the answer, right, you could get the bragging rights, right? What this image is representing. And this is in line with what our session is today. And I'm hoping some of you might have seen this image earlier, right? And if you see closely, there's some hints as well, right, in the image itself. So anyone who can give the right answer, right, they'll get the bragging rights. If you don't know the right answer, you can simply say no as well. But anyone who can give the answer, right, what is the image depicting? Anyone from the audience? Okay, so it looks like this is my first session after the lunch break, right? So maybe I want to make sure, right, people are attentive, right? So please let me know, right, in the chat window if you know the answer. If you don't know it, that's fine as well, right? Simply say no, right? I've typed good afternoon to all of you just to bring us out, right, of the afternoon session, little laziness, right? I would say. Okay. So I see good afternoon coming in. Anyone knows the answer? If you don't know the answer, simply say we don't know the answer, right? So in a way, I'll proceed and give you the answer, right? But anyone who could do a reverse search, right, using Google Lens, right, or maybe take a photo, right, that is also permissible, right? And then no right or wrong answer, you can attempt it. In a way, if you see something, right, and you want to attempt it, that's also fine. Okay, so I haven't seen the answer coming in yet, but in interest of time, right, I'll continue. So the image what you see here represents a concept called as Baby X, and this is developed by a company called as Soul Machines. And this image, what you see here on the screen, basically represents the real baby, and it's trying to basically mimic the real baby of the Soul Machine CEO and his son, right? Who is more like a baby, and rather the baby his son used to look like a baby when he started with the concept of Soul Machines. So if you go to this website, which I'm sharing on the screen, you'll see what the Baby X concept is all about. So as I shared in my previous session, we as humans always wanted to come up with AI systems which could mimic human behavior, right, and human intelligence. So what Soul Machines try to do is they try to create personas in a way wherein when we are interacting with AI systems, they should look like humans. And on that premise, they started building some systems. So one of the early systems what they developed, right, and they tried to call it as digital brain, right? And this is the schematic, right, which is basically showcased here, right? So idea here is the system is going to be virtual, but at the same time, they are trying to mimic the behavior what we have in our real brain, and they are calling it as digital brain. And if you can see, this diagram shows the anatomy, how this brain would function. So idea is you basically give a sensory input to your digital brain. It's going to do processing on that, and based on that, it is going to take some action. And this action could be in the form of finishing a task, or maybe taking some kind of a motory, like a robot, right? Maybe a motory action, right, around in the surrounding. But if you see, right, they have tried to use certain terms like cortex, right, and maybe other things which come in limbic system, right, in terms of mimicking the human behavior and more importantly the digital brain. And this system could basically interact with external systems to connect with humans, right? So we could use Wi-Fi or maybe networks to connect with these systems, interact with this systems with voice, and that, right? So this concept was started almost 10, 12 years back, and they have kind of matured it. And if you go to the website of Soul Machines now, you'll basically see maybe a concept of soul machines now. So I'm playing a video, right, wherein they have coined a term called as experiential AI agents. So we also use a term called as experiential AI, wherein when we are interacting with AI agents, the concept is such that these agents look and behave as if they are humans. So their whole the whole feel how we interact with them in terms of their communication, facial expressions, it is basically a real human being. So I'll play this video quickly so that you all can get a feel of this. This is just a 2-minute video.
Introducing Soul Machines experiential AI agents. Now, human form AI agents integrate directly with your digital workflow tools and LLMs for unprecedented impact. Experiential AI agents act dynamically using a natural interface that simplifies complex interactions and supports easy adoption. They can see, hear, and even empathize more like real humans, cultivating trust and authentic engagement. And connected to the app in ServiceNow or Zapier, they intelligently gather, analyze, and act on data, automating conversational tasks. Experiential AI agents are transforming the modern workforce in industries from finance to healthcare, education, and many more.
So if you see, healthcare is one of the verticals, and they are basically using these AI agents to provide assistance to we as humans, right, who might need some kind of caregiving, right, in terms of taking certain pills or maybe following a regime, right, so that I can control a specific disease like diabetes or other things, so that maybe I get better in my health.
Across functions like HR, imagine a digital interviewer, onboarding specialist, or performance coach triggered to connect with users, then automatically updating your systems with outcomes. CX, triggered by inquiries, an experiential agent can provide face-to-face, empathetic support, automatically capturing sentiment and providing detailed summaries. IT, With an experiential agent, critical IT issues logged in connected systems are addressed in real time, offering personalized troubleshooting and intelligent escalation. Sales. Your experiential agent can engage with leads from marketing platforms capturing key data and seamlessly updating CRM systems. Creating and deploying your experiential AI agent is easy using customizable templates and intuitive prompts to align with your brand and meet business goals. Experiential AI agents help you unlock efficiencies, optimize costs, fill workforce gaps, boost ROI, and elevate your customer and employee experiences. Put Soul Machine's experiential AI agents to work for you today. Start your free trial now. Introducing.
So there is a free trial available if you go to soulmachines.com, and this AI agent concept, right, which I talked about, there are almost 10 and 12 different types of agents which are created by Soul Machines, right? So I could have a personal assistant who could also help me in doing my fitness regime, right? Help me stay in shape, or maybe it could be a caregiving or nursing agent, right? Which takes care of me, right? In terms of reminding me about my medicines and other things like that, right? So it's a very good concept. And if you remember, I talked about agentic AI yesterday, right? So this experiential AI agents could be something which you can go and try for free, right? You just need a Google or email account, and you can register and you can use these agents for 7 or 14 days, right? And you can see how they can be beneficial to you. More importantly, Soul Machine also provides a platform wherein I can new agent as well, which is going to be solving new business use cases for me. So that service is also provided by Soul Machines in this case. There is also one more concept which Soul Machines came up with World Health Organization, and the concept is called as SARA. And again, this concept, SARA, stands for Smart AI Resource Assistant for Health. So if you see the slide, right, there is a link below the image wherein you see a WHO link, and they have basically collaborated with Soul Machines. And this SARA experiential AI agent was created to basically provide better health and caregiving processes to humans like us. Especially, this helps us in multiple ways, right? Because in a way, as humans, we need a lot of advice, right, in terms of what we should do in certain specific cases. So as on today, we rely on experts. We go to doctors, right, and take their advice. So for certain routine things, considering my data being already available with these smart agents, they can give me the first level of advice unless and until there is some specific emergency which they will find out, right? And they'll ask you to go to and visit a real doctor. But in most cases, this AI agent is going to handle a lot of things which are important, right, for our day-to-day routine health and maybe other aspects. So I highly recommend you go and check this link, and this gives you a lot of information about SARA, and this is something which is as an initiative was announced very recently, and they're still kind of working and maybe creating better solutions around that. Another big trend, personally being in industry for a while, we are seeing is around use of AI and IoT devices. So if you see the image here, right, you'll basically see 5 different images. So in the first image, what you're seeing is an apparatus, right, which could help you take blood pressure, right? And this is something I don't need help from anyone else. As you can see in the image, I can just attach that to maybe my hand, and I press a button, right? And my bodily parameters, including blood pressure, could be monitored, and same could be shown to me on the screen on the device, or maybe on my phone, right, which is connected using technologies like NFC or Bluetooth, right, or maybe Wi-Fi, so that the data stays with me forever, right, in the app what I have. Similarly, we are seeing a new trend of wearables which are coming into picture, as you can see here, right? And these wearables, when you put it on your body, right, they basically monitor a lot of parameters about you, right? In a way, it could be your oxygen level, right, your heart rate, right, maybe and other aspects, right, depending upon what my health condition is. And I can basically use this data and process it using the app, which is going to be on my phone. And it's going to help me keep maybe prevented from any untoward incidents, right, which could cause maybe issues with me. So this is basically being useful for many diseases, especially around things like which are heart-related elements, or especially certain lifestyle diseases like diabetes, which can be controlled with the things like what kind of food habits I have, right? And more importantly, when I'm eating, what I'm eating, in what quantities I'm eating, right? And considering that, right, how much blood sugar I have in my maybe bloodstream. If those parameters are monitored, right, in a way, I could basically provide better maybe uh, lifestyle management, right? And that's going to keep my sugar and maybe heart condition in control. And that's where we are seeing a lot of innovations coming in, right? And maybe we are monitoring a lot of things. So third image basically shows, right, glucose level. So again, there are like a lot of non-invasive devices which are coming in. This smartwatch, what you see, right? It has a very small sensor, right, which touches your screen, which is, I mean, even at times you don't need to prick, right? In most cases, I have seen patches which are available, right, from companies like Abbott. You still need to put them on your hand, right, on the inside side, and maybe they using the NFC, right, give you the regular readings, right, for last 24 hours, right? You can sync it with the app, and this is very popular. I mean, only limitation is these devices, right? They cost a lot. So the Abbott NFC patch, which I talked about, it cost about give or take 5,000 rupees, right, in India, and it can only last for about 2 weeks, and we need to change it. Similarly, the watch you are seeing is in the range of say $1,000+ right? If you want to use one. So that's one of the things, right, which is possibly limiting the mass scale adoption today. But I'm hoping as we go forward, right, some of these devices, as we are seeing in terms of smartwatches, becoming more mainstream. But at the same time, some of these smart devices becoming even more smarter, which help you keep a lot of parameters about your health, body, and other things, right, in your control. The third example, as you see here, the person is wearing basically a workout apparel, right, which is in the form of a blue t-shirt. So if you see this t-shirt which you are wearing, right, unlike a watch, it basically can track multiple things about you, right? And in a way, unlike watch, right, it is able to fit more like a t-shirt on your body, but it has a very long battery life, right? It is washable. It can basically track your heart rate, right? Workout performance, real time things like your maybe blood pressure monitoring, right? Or things like calorie burning, right? If I'm doing exercise, right? And it also maintain the history, right? In terms of my workout regime for a while. So there are many sensors on the body, as you can see, right? I have an arm sensor, right? I have an app sensor, right? At the same time, I have non-invasive pulmometer, right? Which is also fitted right on the chest, so that even my respiratory rate and other things could be monitored using such non-invasive device, right? Which looks like I'm just wearing a normal t-shirt, right? This is something which is coming up in a big way, right? And a lot of people who are adopting it. And the fifth smart technology, what I'm seeing here, is from the company called as Muse. So I was telling you an example yesterday, right, from the company which Elon Musk formed, right, wherein they have created a company called as Neuralink, wherein you need to put a chip inside your human brain, right, and you can basically read the human signals or human signals, right. So in case of Muse, this is more like a device which you can just put it on your head, and you can still give instructions or maybe listen to instructions which might be coming from your brain, and it acts as a brain computer interface device, right. And as you can see, right, this is a very what should I say, a very small device, as you can see, right, not so very bulky. Early devices required a lot of electrodes and things like that to be connected on different locations on my brain, right, so that I can provide brain computer interface, right. But now here you can see,
It's
right,
4 o'clock.
it's simple device wherein I can basically just put it on my head, right, and it's going to work in a seamless fashion. And this device could basically have many different use cases. So in a way, someone who wants to just give an instruction by thinking in brain, right, without taking an action, right? Even that kind of technology they're trying to develop using Muse as a device. So I just put a thought in my brain, right, that okay, I want to basically order a pizza, right, and automatically through application, right, the pizza gets ordered. If I want to basically do some action, right, I'm just thinking. So this kind of device is going to be helping me. So we are seeing a big convergence of AI and IoT coming in together, right? So that some of these innovations could help us solve some of the critical problems what we are facing. So especially this last device from Muse, right? That could be also beneficial for people with certain brain conditions wherein they can't move their body parts and they can basically give instructions by just thinking, right? And maybe those instructions would be carried out on their behalf if they need some kind of help. So there are many ways how some of these devices are being used in healthcare, right? So I already gave you some examples like BP monitors, glucose monitors, where I gave you an example of a bot. Then ECG monitors, which is again something which is happening, right, with just one electrode, right, which needs to be put on your body, or maybe wearing a t-shirt like what I was showing in the previous slide. Pulse oximeters, headsets that measures brain waves, as I was showing Muse as an example. Cloths with sensing devices, as I showed in the previous slide, right. These sensors are basically embedded right in the medical equipment, dispensing systems, surgical robots, and device implants, right? So that we have things which we call it as connected caregiving, right? So anything and everything around me could be basically used to provide better care to maybe an elderly person or a patient who might be dependent on some of these systems around us. So we are seeing a lot of these smart sensors, smart devices, right, becoming better and better in terms of caregiving and surgical robots, right, which could help us become better in terms of our health requirements. So we are seeing a lot of innovation coming in terms of wearable technology as a device. So this device is very crowded. I'm just showing you one slide here, right? So there are many companies who are involved, right, in terms of all the things, right? That includes glasses, clothing, right? Smart bands, which could be wear smart jewelry. Even we have Ring from many companies, right? Like Ringly, Samsung, and others, right? And plus we have many smart headgears, right? I showed you some examples. And watches. This is a huge market, right? And maybe there are many companies, right, who are just using this wearable as a technology. And that's where extension of a wearable or IoT technology is being count as a new term as digital health. So what digital health is, if you see the older days, right? We started with use of cell phone, then computers came in 1980s, 1990s we had internet, right? And 2000 onwards, right? We see a lot of new applications wherein DNA, RNA sequencing could be done, right? Social media is there, right? And I'm having basically anything and everything which is available on my mobile. So combination of digital technologies and basically genomic sequencing is something, right, which is going to be helping us create the digital health revolution, which we are seeing in last several years. And there are many companies who are working in this space. So one of the top companies I would say is Google DeepMind. And there was one problem which was not solved in last 50 plus years, right, around genome sequencing or genomics. And they solved that using their AlphaFold 2 model, which basically solved the genomics problem. And they're able to now identify specific type of DNAs, right, which might be responsible for certain types of diseases. An idea here is once we know which RNA and DNA sequence is causing certain diseases, we can basically find certain cures for such diseases more quickly. An idea behind finding this cure is to prevent such diseases from progressing in human bodies and things like that. So that's where we are utilizing all these systems like wireless sensors, using IoTs, mobile connectivity, social networking, genomics, imaging, all the data universes which we have created and health information systems for doing basically disease management, diagnosis, more importantly, disease prediction, as I was telling earlier, right? And I'll show you an example in one of the future slides, wherein you could basically predict before a disease could come to you, right? In some specific cases, right? By doing some maybe preliminary preventive investigations, right? And based on that, ultimately what we are trying to do is we are trying to reverse any disease conditioning from occurring or preventing such diseases from coming into play. So this digital health revolution is something, right, which we are seeing as a big thing, which we are which we are seeing in many innovative solutions, which started coming in 2020 onwards. And I'm going to be showcasing you some of the examples as I go forward, right, in terms of how these digital health systems are being created, right, and how these multiple emerging technologies are being used for disease diagnosis, management, prediction, and prevention, and more importantly, act as personal health navigator, which is out there. So this concept is very simple. So if you see in the current world, if I visit a doctor, it's analog in nature, right? So the kind of treatment I get today when I visit a doctor is completely dependent on the doctor's expertise and maybe how he is approaching the individual patient like me when I meet him. And there might be some inconsistencies, right? So depending upon how much workload I have, right, I might be giving, say, suppose good time to certain patients who come early in the day, right? Or I may not be able to give sufficient time to people who might be coming late in the day, right? If there are many medical emergencies, I have limited time, right? And more importantly, the whole experience is delivered in analog and paper way, right? So when I go to physician, they may not have any history of me, right, in the written form. So what they do is they may look at your old files, right, which contain what kind of ailment I had. If I've done some investigation or reports in past, I may need to sift through that data and maybe look through that information on my own. If I don't do that, maybe I might be missing on certain information which might be important in that patient's case. So in a way, these physicians, unless they do their own checkups in their own clinic or in their hospital, right, they'll not be able to get the same level of information, right, which might be available from past. Similarly, there could be emergency event, or more importantly, certain chronic diseases for which I'm doing follow-up visits, wherein the old data, right, for my previous visits is going to be also important. So we are seeing some structure coming in country like India, right, but we are still mostly analog and paper-based, unless I'm going to a corporate hospital or a big hospital, which are having some kind of EHR systems, right, which maintain my personal health data. So this analog delivery has a lot of flaws, and this is basically impacting, right, how we treat the patients, right, and we are not able to personalize the treatment. But if I go to the right, and I see a digital and network world, so what you see here is, as a patient, all my information is available online, right, and these network tools, right, are created in a way I have my health records stored in cloud, and irrespective of what hospital or maybe what doctor I'm visiting, they may be able to access my information through cloud and me having a unique ID. And this is again another project which government of India is also taking up, wherein for every individual in India, they should be able to maintain the health records in a universal form in cloud-based system. And this got started around maybe COVID time, if you all remember. So when we took COVID vaccines, right, everyone was given COVID vaccination certificate, and that's where my digital health ID got created, right? Anyone who has taken the vaccination at that time. So what they're trying to do is they're trying to build a new record system wherein my health record needs to be portable and they need to be available irrespective of where I'm going. So this is something which is already available in other countries like UK and USA, right? Wherein irrespective of what doctor you visit or what hospital you are in, like my Aadhaar ID, right? There is a hospital ID which is connected to maybe all the systems, and I can pull all the information, right, about the particular patient, right, from all the locations which is available. So what we are seeing, if this happens, this gives you a real-time and continuous information across care settings. This makes doctor's job easier, right? I can look at a particular parameter, right? If I'm a specialist for a particular disease, like say in case of, say, suppose respiratory disease or lifestyle disease, right? I can customize my treatment, right, for that particular patient, considering all the records which are available to me. Again, This also helps the doctor get a comprehensive and relevant view of the current health status, and maybe do the chronic disease management like diabetes management and other chronic disease management like heart disease better. And more importantly, my focus is going to be around wellness so that we stay healthy. Instead of we focusing or visiting a doctor, right? When I am having particular condition, right? Or maybe I'm suffering, or maybe becoming worst in case of my condition, which is out there. So idea here is around prevention. We are trying to be proactive, not reactive, and we are trying to maintain the wellness, right? And that thought of wellness needs to be implemented. So this is where the digital health is coming up in a big way. And this term, which has been coined in last 4 or 5 years, is called as IoT of me, right? Wherein we are seeing new smart devices, clothes, shoes, or maybe wearables, right? Which could be put on your maybe hand, or maybe armband, or maybe as rings, right? Or maybe jewelry for that matter, right? To measure vital signs and other parameters. At times, we are seeing a new kind of pills, which could be swallowed by a human, and maybe they contain a camera, right? Which is going to prevent, right? Maybe some kind of invasive surgery, right? Which might be required, right? So currently, if I need to do maybe investigation within the body, right? I need to send the camera inside, right? And it is very difficult. And that's where we are seeing small cameras which are just put inside a pill, right? And I can basically get the whole inside image, right? When I'm able to have that camera move within the body. So all in all, right, we are seeing use of IoT, right? Having moving under everything under the skin, right? And that's where people have coined the term as IoT of me, wherein patients and consumers, right, they are able to share the data with care provider. In this case, it could be doctors, hospitals, right? And they use this data, right, as the electronic health record, right? And this becomes a gold mine of information for them to provide personalized care. And I'm going to be showing you one example of practical example of how one researcher, and he's from basically Institute of Future Health in US. His name is Dr. Ramesh Jain, and I'm going to be talking to him in a while, right? He has created something called as personal health navigator, right? So if I need to go from, say, suppose one place to other place in a new city, right? I go to Google Maps, and Google Maps tell me, right, in a way, how I can visit to that location, right? It acts as a navigator too. It can give me multiple options, right? And I can decide what option I need to choose. Similarly, this personal health navigator system, what they have developed, it basically gives you options, right? Wherein you could stay healthy, and maybe your focus is on wellness, and maybe it is the complete bodily parameters are monitored using all these smart IoT devices, right? To give you better care as we go forward. So there's some benefits of using AI and IoT in healthcare. So one of the top benefits I would say is reduced cost, because here our focus is on wellness, right? Staying healthy. If we don't stay healthy, and if there is a occurrence that, okay, there is an emergency and I need to go to a doctor, it's going to cost me much more as compared to me staying healthy, right? And maybe my focus is being healthy, right? And have wellness regime being followed all the time. So that's where it's going to convert into a reduced cost for me, because my focus is on staying healthy, right? And that's where I'm investing my efforts on. Second advantage what we get is improved treatment outcomes, right? Because I have all the data available to me, right, in the portable form. And I can see historically, right, which drugs have been efficient in my caregiving, right? What is working, what is not working, right? What triggered particular condition, right? And as a doctor, I can give better treatment. I can do a real-time disease management as a doctor as well as patient. So if my glucose level is high, right? So I could have a patch which could secrete insulin, right? Without even my intervention, if there is a glucose level which is beyond certain threshold. And the IoT device would automatically decide what should be the dose, considering my bodily parameter. As on today, what we see in our case is, when you go to a doctor, generally they end up giving you same treatment like everyone else. But we all need to understand every human being is unique in terms of their anatomy and physiology. And The treatment needs to be unique according to that individual, but that's not happening today. And that's where these IoT systems are going to be coming to our rescue, right? Wherein we can give personalized care, right? Because we are able to monitor individual parameters for that particular patient or individual, right? And maybe do the customized treatment which is there. This also helps in minimizing errors, because one of the biggest challenges in the healthcare industry is human errors. And I have also personally seen some of these human errors happening with my loved ones, wherein a doctor was giving certain medicines which should not be given to a patient, right? In case of my relative, right? Because they had certain specific condition. So if I am using modern LLM and AI systems, and if a particular drug is prescribed, that system is going to give me an alert or a red flag, right? That, okay, this person is allergic to this substance, or maybe this drug might not be good for the person considering a certain liver ailment or a kidney ailment, right? Or if you give a certain dose which is on the higher side, then there is going to be a negative impact on the body. And that's where these systems are going to be minimizing those human errors. Fourth is improve the patient experience. This is something which is very critical. I feel when you visit a doctor, right, if you like the doctor and doctor counsels you well, you like the whole experience in a way that, okay, half of your ailment is already gone, right, and you feel better. But if this whole process which you go through is cumbersome, that, okay, you need to wait for doctor to be available, doctor is not counseling you well, right? He's just simply writing certain medicines without even talking to you, right? So in a way, that experience nobody wants. We want to understand what's happening to us because we are concerned, it's our body. And at the same time, what treatment is being done, right? Why it is being done. That is something we all need to understand, right? And this is something which could be personalized when we go through this experience. And the last and the foremost is security. So in a way, we can put a lot of safeguards, right, in maintaining this electronic health records, right, in this AI and IoT system, so that the data would not be compromised, right, and maybe could be misused. And this is where we are seeing a lot of research happening, a lot of new solutions coming into play, right, which is helping us improve the security of some of these devices. At the same time, I talked about the benefits, but there are some challenges as well, right? So if you look at maybe some of the challenges which are there today, one of the biggest challenges is interoperability between medical devices. We see that different interfaces these medical devices have. At times, the data is in different format, right? So if I'm using data from one provider, and maybe if I'm using same data from another provider, right, it might be in different format. So that creates difficulty for the caregivers, right? And when we are creating these systems. And that's where it becomes very important, right, that we come up with a lot of standards. So in US, we have a standard called as HL7, and that is something which everyone needs to follow as part of HIPAA requirements. And this makes sure that interoperability is there. We're also working with some hospitals in UK, wherein we are maintaining health records, right, for certain government systems. Again, there are certain standards which they are following, right, in UK, so that the data is interoperable in multiple systems, multiple devices, and things like that. And that's where the second challenge comes, wherein we need to maintain integration between different EHR systems, electronic health record systems. So in a way, if I have a legacy system or maybe a modern system, I should be able to have them store the data, right, which is going to be in the same uniform form. If it is not there, it could cause issues with me. And that's where I need to have patient and provider participation. So provider would include your hospitals or doctors, right? And they all need to participate. If one of the elements is missing, right, it's not going to work. Again, one of the challenges is security. Since this maybe a lot of these technologies are still in nascent stage, are being developed, right, over a period of time. We are seeing some challenges, right, in terms of some security breaches happening, right? And maybe if you're not following standards like encryption during data at rest, data in transit, right? We are seeing some security issues also. If I need to give you a bad example, right, look at a data breach which happened in India in Ih&Ms Delhi. And that was something which was not good, right? Those systems were inoperable, right, for several days. And that really impacted a lot of things which doctors and maybe caregivers wanted to do around that. And this is one area, right, where we need to do a lot of research and always stay one step ahead as compared to cyber criminals who are trying to breach such systems, considering the importance of data what we store. Then we also need a lot of resources and skills, and which is very hard to find. Let me tell you that, because we are developing many complex systems, and that's where we are seeing this as a challenge. Wherein for certain people who have the right skills, like understanding how HL7 protocols work, they're very hard to find. And that's where we are forced to train new people. But at the same time, training people and maybe making them skillful takes time. And not everyone is able to do that quickly. That is another challenge what we are seeing is smart AI systems what we are developing. And the last is human nature. As humans, we are basically bound to do things in certain way. And maybe when we bring in this change, not a lot of people are receptive to that change, especially people who come from that old school background. I know a lot of doctors in India, right? If you go to them, they still like to go for that pen and paper model, which is not efficient. And that's where we need to implement the proper change management in place and have everyone embrace this change, right? And maybe utilizing the smart AI and IoT based system in healthcare. And that's where we need participation from both caregiver as well as patients, so that this could be humanized, right? And maybe we all participate in this process. Okay, so before I continue forward, I just wanted to do a quick check, right? In terms of, are there any questions from the audience? If there are any questions, please type it in the chat box so that I can take them. Please type the questions in the chat box if you have one. If you don't have questions, I'm sharing an image on the slide deck. Does anyone recognize this gentleman? His name is Dr. Ramesh Jain, and believe it or not, right? He's someone who studied from VNIT Nagpur, and he's one of the pioneers and innovators in the field of AI and XR, AR, VR, and multimedia. And there are many patents on his name. Again, he has established many pioneering companies, right, and many initiatives, right, as part of his journey. He's one of the Ih&Ms Distinguished Fellow. He's also part of IEEE, right? All in all, right, he's someone who commands very high respect in the industry, right? And Dr. Ramesh Jain, I happen to know him personally, and I've been following him for several years, and he's one of my mentors, right? So he's part of an initiative called as Institute of Future Health. Has anyone heard about Institute of Future Health? Can you type as yes or no in the chat window? If you don't know what Institute of Future Health, simply say no. But if you know it, you can type yes, right? Or if you don't know it already, right? What I highly recommend is you go and Google it, right? And you can find it online. So in a way, Institute of Future Health and Dr. Ramesh Jain is the founding director of this institute. And they're working on many pioneering concepts as far as new healthcare solutions is considered. I could talk about at least 50 new innovative solutions which are coming in from Institute of Future Health. And there must be almost 100 plus PhDs, right, which are happening from Institute of Future Health at University of California in Irvine. So anyone who has interest, right, especially in healthcare research, this is the gold mine for you, right? If you visit their website, wherein you'll see a lot of the PhD scholars, right, working in just in the field of creating innovative solutions as far as future healthcare is considered. So if you see, I'm showcasing a title here. It's called as PCU. So PCU stands for Personal Care Unit. And this is the new healthcare service architecture which Dr. Ramesh Jain proposed. And there is a link which I'm showing below his photo, right? So here he has written a blog about this concept, right? What it stands for. So when early on, when I was talking about the concept of utilizing smart sensors, and those sensors helping us stay fit and maybe predict any health condition from happening, right? So that we can prevent those diseases or health condition from happening. This is the exact concept, right, which he talked about. In fact, he presented this complete concept at one of the IEEE conferences, right, this year in July. And his research paper, right, with his colleagues from Institute of Future Health, got the best research paper award as well in terms of the concept which is being pioneered. So I highly recommend you to go and check this, the blog link from medium.com, which I'm sharing, wherein he has described how this personal care unit, which he has pioneered, is going to be working, right? So the concept is simple. So in a way, you see the person who is in the photo in the first left corner, right? He has his phone and there is a band on his hand, right? And he's eating something, right? So in the morning, right, the guy is assuming, right, he is basically a diabetic patient as an example. So he's taking a low fiber breakfast, right? And in his ECU, which is basically an app on a phone, and maybe my tracker, right, he's able to file how many calories he has taken in his breakfast. So in the noon time, I'll get a reminder, right, through my tracker, right, that I should take a 10-minute walk break. If I don't do that, it's going to impact my blood sugar level. So automatically, according to the time, right, I'm getting reminded. In the afternoon, I am feeling tense. So my tracker is going to nudge me, right, and identify what I'm feeling, right? And based on that, it's going to ask me to do 2-minute breathing exercise, right? Just to remove that anxiety, right? Tenseness which is going through me. And similarly, in the evening, right? In a way, it's going to remind me to dim the lights, right? So that my mind is prepared to go for sleep. If I keep the lights on, I may not be feeling sleepy. Or more importantly, if I'm using phone more often, right, without dimming the light feature on that, right, it's going to be something which is not going to help me basically sleep quickly. So there is another blog wherein he has explained this whole concept in a beautiful way. There is also a research paper available on the IEEE website, right, about this concept of PCU, right, wherein the idea here is, in a way, we maintain our healthy life balance, wellness, in a way that we don't fall ill, or maybe we are able to detect diseases early, right, before they could affect our body. Okay, so another trivia, right? Does anyone recognizes the photo on the left? Do you know who is the character in the left? Which movie franchise it is from? At least some of you might know this, right? In terms of which movie franchise I'm talking about. Anyone knows? So this movie franchise is almost 25 years back, right? Even I was in engineering college at that time, right? And he was one of the very famous characters at that time, right? So does anyone remember? I mean, if you can answer it correctly, right, you can get the bragging right. Okay. Okay. Again, Salim sir looks to be very fond of these movies, right? So bragging rights to him. The movie is called as Matrix, right? Let's clap for him, right? Virtually here, right? So thanks for answering that. So he's from Matrix. But the trivia here is, if you see, right, what he's saying, right, to maybe his disciple, as in case of Matrix. What if I told you Google does not have a medical degree, right? And what we find these days is, if you visit a doctor, in a way, they already realize that you might have done some kind of Google search before coming to them. And whether we all agree or not, right? All of us look at certain symptoms, right? And we Google it and try to do the diagnosis on our own using Google, right? So there is a famous doctor, and this was basically a viral uh, tweet, or maybe there was a viral social media around this, wherein a doctor kept OPD charges I'm showing on the right. And please understand, I have a lot of respect for doctors. My wife is a doctor. So what he did here is, my diagnosis, my treatment is only charging 200 rupees. But my diagnosis and your treatment, assuming you have done a Google search, in a way, it's going to charge you 500 rupees, right? So all of you know, right? If you're working somewhere, once in a while you go and ask for some kind of medical certificate, right? So you may need to pay him 500 rupees for that. If you have any Google doubts, he's asking for 1000 rupees. Your diagnosis and my treatment, 1500 rupees, and your diagnosis and your treatment, he's asking for 2000 rupees. So in a way, this is something which is we all need to laugh at, but at the same time, see how things are taking shape, right? Wherein instead of relying on an expert, right, who spent his life, right, practicing medicine, we are not trusting him and we are trying to trust the systems, right? And that is where we are seeing big changes coming in. If you go to this link, which is from NDTV, right, you will see this hilarious notice. And this is no joke. This is a real doctor who did it in his clinic. Okay, so since we talked about Google, it's my moral responsibility to tell you, right, about Google's initiative in health. So they are working on many initiatives, and there is a specialized website what they've created. It's called as health.google. Have any one of you visited this website, health.google? Anyone? If you have visited, simply say yes or no. Or if you have visited it, what feature you have used on this website? Is anyone aware about any specific type of feature, right, which you found beneficial for you? If you have not visited, you can simply say, no, I haven't visited, right? While I'm waiting for the answers to come, right, one of the important things what you'll find on Google Health is they have an app which could be used for detecting a specific type of maybe skin condition. So instead of going to a skin specialist to find out maybe if I have some skin ailment, you need to just use a Google app and maybe use the app, open it, take a photo, and it's going to tell me, right, in a way, what kind of ailment I have, right? What kind of skin ailment I have, and what is the typical treatment for that. And at the same time, this app also tells you, right, in a way, what you should be doing, you should not be doing. But more importantly, if the condition is such that you need to see a doctor, it will always remind you to visit the doctor, right, and maybe do it in a very graceful way, right, so that you're not doing things on your own. As we saw in the previous slide, right, we need to trust the doctors, right, and not make decisions on your own. Similarly, they work on many initiatives. So if you see, right, I talked about genomics and genome sequencing. So they have worked on a problem called as AlphaFold 2, right, which is part of their DeepMind division, right. This is something wherein they're trying to do genome sequencing, identifying which DNAs are responsible for certain specific type of disease and things like that, right. So all in all, right, there are many solutions which are created by them. And the idea and the mission what Google Health is having is use Google tools, technology for research, and maybe the basic premise is they want us to live longer and healthier life. And that's where if you see even Android operating system, it has on our phone, it has a lot of features, right, around our health and well-being, right. So that is also collaborated with the Google Health platform. So if you visit this website, you will see a lot of tools which we can use, right, in our day-to-day life, right, and maybe make our experience better. So I know I have limited time, so I'm just giving you references so that you can go and check it on your own, right, in interest of time. Okay, then another area, right, wherein I have personally done some research and some good work was in the area of basically radiology, right? And again, we see today's radiologists, right, sift through many CT, X-ray, and MRI images, right, or ultrasound images or PET images. But what is more important is when they go through these images, right? So as an example, if I'm trying to look at some kind of specific type of cancer, right, in particular image, and as a doctor or a radiologist, when I'm analyzing that image, and imagine my job is to just go through thousands of images, right? In a particular day, depending upon how many patients I need to go through. So the doctor might have some limited speed, fatigue, or experience. And the person could basically do some mistakes because, in a way, uh, it's dependent on the experience and expertise of an individual. But imagine if I can develop an AI-based system, right, which can do this much more efficiently in less time and in a more automated way, right? And pointing the doctor to a specific image so that the doctor could look at that particular image and maybe make a decision. So that's where we are seeing a lot of new ways happening. And you can see, right, as an example, I'm showing you, right? If you look at the image which is showing on the right, it's basically a skull image. But looking at this skull image, which is an MRI image, can you identify or mark abnormal regions, right, wherein you see something which is not right? So if I say you are a radiologist, maybe you can do it with good accuracy, right? But imagine you don't have that experience, right? Or maybe I'm not looking at this image, or I'm looking at an angle of a different image, right? I might miss out on maybe an important aspect, right? And that is where I have abnormal region and I miss it advertently or inadvertently, right? It's going to be impacting on the patient, my efficiency, or maybe my decision to identify that region. If I do it correctly, the patient would be safe. If I do it incorrectly, you never know, right? The patient might lose life. So it's life and death for people here. And that's where, as you can see, if I make use of techniques like segmentation and you make use of AI systems, this system, even from thousands of images which are supplied to it, within milliseconds, it could find maybe certain regions, as you can see here, right, with good accuracy. And you just get to see the image C, right? And from that, you can make out, right, whether something is wrong. If it is wrong, what should be my report around that, right? And that is what basically, as you can see in this image, that you are seeing basically a skull in a 3D shape. And I am seeing the region which is highlighted, right, where might be an issue, right? Or maybe there might be some kind of cancer or brain tumor which could be involved, right? Which is going to be harmful for this patient. So this is the kind of systems which is being developed. And for that, we use the concept of image segmentation, wherein we look at the digital image and we try to partition it into multiple segments, right? We call them a set of pixels or image objects. And from that, the goal is, after doing segmentation, we try to find out something which is going to be more meaningful for us, right? In terms of objects, boundaries, by following some kind of edge detection, identify anything which is unusual in terms of, say, suppose, cancerous section or maybe carcinoma and things like that. So this is another example, right, wherein you can see human femur of the left hand, right? So here also, right, using an X-ray image, I can basically look at the contour, right, and find out what the outer surface looks like, what the maybe inner surface looks like with the compact bone, which is shown in green, right? And maybe what is the bone marrow, right, which is shown in blue. So this is an example of image segmentation, right? So that we could look at all those things and see if there is an abnormality in any of those sections. So here is another example wherein we do the whole brain segmentation. So what we are doing here is we are trying to identify different regions within the brain. And idea here is to locate the tumors. And we do it in a way, right, so that once we identify the tumor, we try to mark it in a way that if a surgeon needs to do the surgery, they know exactly where they need to do the incision, right? Because breaking open the skull is not easy thing, right? And again, doing a brain surgery is one of the most complex types of surgeries, right? And that's where, if I can tell the doctor, right, with very precisely using the segmentation that, okay, where the cancerous part is, where the tumor is, and using those tumors location, the surgery could be done with good precision using robots. That's where we are seeing some of these systems being developed. Another example, here you see a retina of an eye, wherein you try to do a retina segmentation. So this could be done with the context of 2D, 3D, 4D, right? And idea here is to find out maybe diseases like glaucoma or other conditions, right, which could have an impact on my eyes. And these days, especially looking at a lot of people suffering from diabetes, right? Detecting such conditions early on, right, could cure the patient condition, right, more quickly. Otherwise, there might be an impact on people even getting completely blind, right, if the treatment is not done more quickly. Here is example of a 3D CT scan of the chest. I know there were some sessions done early on, right, around the pulmonary aspects, right. So here you can see, right, we are trying to look at how the lungs look, whether they are healthy, not healthy, right? If there is a hole somewhere, right, or maybe inflation somewhere and things like that. And that's where we also do segmentation of various artifacts. So how these image segmentation technology in the smart systems work is showcased here, right? So you do the image acquisition, it could be through MRI, CT scan, X-rays, right? You do some kind of pre-processing in the first step. Once the pre-processing is done, you give it to the segmentation module wherein you try to divide that image into various segments. And using my knowledge base, right, I do further segmentation. And based on that, I do add representation and description, right? And finally, we do recognition and interpretation and finally give results. So in a way, this complete knowledge base helps me in doing the image segmentation, identifying if there is any abnormalities in my segmented images. And based on that, that abnormality could be given to a radiologist so that it becomes their job easier and they can simply report that part. So there are various methods. So this is according to how over a period of time, right, various AI, ML, and deep learning, and now generative AI technologies have evolved. So starting with the first method is region-based, second is clustering method, right? Then we have third as classifier models, which includes KNN, maximum likelihood. And finally, we have hybrid methods, right, wherein we use deep learning and maybe modern generative AI techniques. And this is something which is used in a heavy way, right? So there are many examples which are given here one by one. So in interest of time, right, I'm just simply going through this. I know it's a time-bound session, so I'm not able to go through all the things, but I'm hoping, right, you can look at these methods individually. And there is a lot of research happening, right, in this field to improve accuracy of these systems and maybe make human doctors' job easier. So here is an example of region-based method. So here you apply thresholding according to the histogram and find out intensity, right, or foreground and background part of the image. And based on that, you apply local thresholding, Utsus thresholding, right? And based on that, you are able to identify if there is an abnormality. Similarly, we have a concept of region growing, right? So we might start to create a segmentation from a particular pixel. And we continue to grow that, right, till the time we are able to identify a particular segmented image, right, as per my knowledge base. So if you go to this link here, this complete implementation along with the code is available on Kaggle, and you can basically play with it. Then classification methods are here. So again, here, if I need to identify diabetes using KNN. So if I go to this Kaggle link, it basically shows how KNN model works, right? And it is able to identify, right, from the sample data which are already labeled, right, to do the diabetes classification, right? That is what is something which is going to be beneficial in our case. Then maximum likelihood, this is another method. So there's something again which is available on Kaggle, and you can look at the sample data and maybe how using a small training data I can still significant results in these clustering and maybe other methods which are out there. So in clustering, again, we have three types: k-means, fuzzy, c-mean, and expected and maximization, right? So if I look at k-means, right? So this is again explained in this example, right? How I can do segmentation of images, remove the outliers and noises, right? And if you see the link which is given on the slide here, right? This basically gives you the whole method, right? And all the code, right? Which is used for applying k-means clustering for doing image segmentation. Then we have fuzzy c-means clustering. So this is from Kaggle again, wherein I can take a MRI image of a knee, right? Which I'm showing on the right, right? And basically look at that to find out, right, if I see some unusual overlapping. So generally, if you need to do knee replacement, right? So this is something, a technique which could be utilized, right? If you don't see the proper fluid, right, in certain regions and things like that. Then expectation maximization is another technique, which is again explained in this example. So, and finally, we have hybrid methods, right? Wherein we try to use combination of multiple methods together to do the segmentation. So again, medical image segmentation is very large, right? So year 2000 onwards, we have seen deep learning techniques coming into play like CNN, FCN, UNet, right? And RNN, right? And using that, we are seeing basically image segmentation happening with a lot of accuracy, right? And maybe in a way, in a better way. So this is an example of a CNN, how this could be used. Similarly, FCN, UNet, this is something which has the highest accuracy, right? Because I can basically have many encoder layers, right? Followed by pooling, right? So that I can extract a lot of different factors of the images, right? So if you see the links here, you'll find the unit image segmentation examples if you go to this links, how this works. Then finally CRN. So here you'll see that I'm able to give feedback back, right, to my previous layers, right? And that makes my maybe my model better. That's what happens in recurrent neural networks as well, wherein in RNNs we have LSTM and GRU based models which are very highly used. So here you are seeing, right? I take the current image, then do the segmentation, and then I basically give the output. And this is basically a segmentation of heart, right? Cardiac images, so that I can see if there is some sort of blockage in the heart or not. So this is a 2D MRI slices, right? Which you have got. So if you go to this link, you'll find this complete article, right? With the source code and other details, right? For the RNNs, how they're used for doing image segmentation. So a lot of you must be thinking, right? If I need to start some of this journey, in a way, if I want to develop my own solution in healthcare, right? So what I should be doing, right? So generally, I recommend you should first create certain foundational knowledge, wherein you understand maybe some basic programming languages, some of the models, and once you have that understanding, so that you can basically apply your learning, right? I highly recommend you to start at level 1, wherein you go to Kaggle and other open competition website, right? Wherein you use the open existing pre-trained networks, right, to solve medical open source data which is available to you. And this gives you that exposure what you need. Then you can go to the next level, right, wherein you already have some experience, right? So you can look for new data sets, right, for medical imaging and apply more modern models like UNet, VNet, right? And try to do the maybe accuracy improvement and things like that. And then finally, you can go to an advanced level wherein you can build your own model from scratch, or maybe train an existing model and provide deep reinforcement learning, right? And maybe create a model which could have a memory and things like that, right? Or feedback, so that your journey becomes better. And this helps you get to a more advanced level. So here are some of the learning resources. So in a way, this FDP was more focused around AI in healthcare, right? So I'm giving resources which is going to make you better, right? In terms of your understanding, right? For AI for medical diagnosis. The first is the course from Coursera. Second is from Udacity, wherein they have a nano degree for AI for healthcare. If you get this degree, right, this basically is going to help you learn, right? A lot of things which are relevant, right? The way I just covered in a couple of my sessions today and yesterday. Similarly, Stanford also has a specific dedicated website, aimi.stanford.edu. If you go there, you'll find a lot of useful resources in terms of data sets, research work, right? A lot of healthcare-based focus solutions which are being developed, right? And it is kind of being just not studied in research institutes, but it is being applied in industry also. There are a couple of more links to learn around AI and healthcare opportunities. So here, when I was talking about Kaggle competitions, so you must have already heard about it. Go to kaggle.com/competitions, and you'll see some of the various competitions which are out there. So if you see here, right, I have done a search, right, and I have tried to look for competitions which are, see, suppose healthcare related. So the first competition here you see is OSIC pulmonary fibrosis progression. So you do have images, the data set is given, and you can apply your own model, right? And maybe find a problem and win the competition. And look at the prize money. It is $55,000, right? Similarly, there is a second problem. It is for $30,000, right? Again, this is for pulmonary embolism detection, right? So in a way, there are many problems which could be active or inactive, right? And maybe you could basically apply your knowledge, right, to gain knowledge, but at the same time solve some problems. And if you win the competition, right, you get the money as well as the bragging rights. Here is another grand challenge. So this is something from past, but they keep posting new challenges as well, right? So here you'll see a lot of medical imaging data which is uploaded, is available to you, wherein you have many challenges, algorithms which are there, right? And you can basically apply biomedical imaging and AI, right, to solve some of the problems. So this is another great resource wherein you can register, right, and maybe show your talent. So in summary, right, if you look at how healthcare systems are evolving, right, we are seeing AI being used, right, in a big way, right, in all the stuff. But one area, right, I see there is a huge research being done is around medical image segmentation. There are various new ways being proposed, right, in terms of how the segmentation is being done, right, and a lot of new AI applications are being developed using image segmentation and new techniques, right, so that certain critical diseases could be detected early and we can cure them. Apart from that, I also talked about various agentic AI models which you can develop for giving personalized care, or maybe having a personal assistant which would help you do healthcare navigation and things like that. So all in all, there is huge potential. I request all the audience, right, to consider this field, right, being very ripe for you. And more importantly, I'm sure last 4 or 5 days, right, you must have learned a lot of good things, right? So my advice to you would be, just don't stop here, right? Go through all the resources which are shared by all the experts, and more importantly, use this knowledge what you could build, right, in terms of solving certain real world challenges, real world problems, because there are many of them, and you continue your research. So with that, I would open the forum for questions. So if you have any questions, please post it in the chat window. And I would like to quote our ex-beloved president, Dr. APJ Abdul Kalam, and he said, "Excellence is a continuous process and not an accident." And that's where my recommendation to all the participants is, you did the first step. You have been part of this FDP session. You learned a lot of things, right? And that's where we all, as researchers from academia and industry, need to come together, collaborate, right, and solve the real world problems, especially in healthcare, right, and solve it in a way, right, we help India, right, maybe being one of the most populated nation in the world, right, solve our healthcare challenges in a unique way, because we have many unique problems. And that's where your focus should be on maybe solving these problems and making India great, right, by solving some of these real challenges what we have. So with that, I will request the organizer, right, just to check if there are any questions, so that I can basically answer those questions in the remaining time which is available to me.
Yes, participants are requested, if you have a question, then please post it on the chat box. Dr. Bilal said about that Google link you were asking about, sir. We haven't visited, but we'll visit definitely.
Okay, understood, sir. Thank you. And I would advise Dr. Bilal and everyone on this group, right, please do visit all the references which I shared, especially health.google. You'll find a lot of useful information there. And more importantly, as a researcher, you should also visit Institute of Future Health, right? In a way, I'll share the link of that institute, right, for your benefit, right? So just give me a moment so that everyone has that, right, in the chat window. So this is going to have wealth of information, right? And the best part is the person who founded the Institute of Future Health, Dr. Ramesh Jain, right? He studied from Nagpur. He has a Nagpur connection, right? he has many first on his name, right? And he's also called as maybe in a way one of the first AI pioneers to apply AI in the field of healthcare. So you'll find a lot of things, right, on this website, right, which is going to be beneficial for the audience.
On behalf of Computer Science and Engineering Department, ACET Nagpur, it's an honor. I'll take this opportunity to thank Sir Dr. Rizwan Ahmed for accepting our invitation and for sharing insights of smart healthcare system. Right from John McCarthy's research, Jarvis, agentic AI, AI assistant, IoT in healthcare, digital health, implanting a chip in the brain to cure critical diseases, and aware the audiences about challenges in AI and IoT, and making us understand why let a human do it when the AI doesn't matter. Thank you, sir. Thank you for both the sessions. Both the sessions were very informative and interactive.
Thank you, Dr. Manish Asudani sir, and everyone at Anjuman College of Engineering, especially Professor M.S. Khatib sir, Razak sir, and all the faculty members, and especially all the attendees, right? You have made both the sessions very interactive. So I appreciate you being very attentive and following along. I hope you found these sessions beneficial, and I look forward to staying maybe in touch with you. I'm sharing my email address here. So if you have a research problem or you need my help with something, please do approach me via email, or I'm sharing my LinkedIn details as well, right? So you can follow me on LinkedIn. I keep posting a lot of things, right, from the perspective of learning stuff in AI and healthcare and other aspects wherein we are doing work. So thank you once again. I'm really grateful to be part of this FDP and I could interact with you. Thank you all to all the organizers. Thank you once
Thank you, sir. Thank you, Dr. Rizwan Ahmed, for accepting our invitation and delivering a nice and informative talk. Thank you so much.
Thank you so much, Khatib sir.
Have a great day.
Thank you so much.
Thank you, sir.
Bye-bye.
Have a nice day.